Hi everyone, welcome back to my YouTube channel and today we are going to talk about shaken baby syndrome. So let's start topic with introduction. Shaken baby syndrome, also known as abusive head trauma, is a severe form of child abuse that results from violent shaking of infant or young child. Babies have weak neck muscles and a large heavy head relative to their body size. When they are forcefully shaken, their brain moves back and forth inside the skull, causing brain injury, bleeding, and swelling. It is a medical emergency and major cause of death and permanent neurological disability in infants. Age groups affected by shaken baby syndrome. Shaken baby syndrome most commonly occurs in infants that are younger than 2 years. In most cases, it occurs around 6 to 8 months of the age. Babies are more vulnerable because their neck muscles are not strong enough to support the head during shaking. Mechanism of injury. When a baby is violently shaking, the head waves back and forth, causing the brain to strike the skull. This leads to brain bruising, cerebral contusion, and brain swelling. Tearing of small blood vessels occur as a result and occur around the brain that causes subdural hematoma. There is also retinal hemorrhages that occur due to rupturing of the blood vessels in the eyes. Often there is no external bruising, making diagnosing challenging. The classic injury triad in the shaken baby syndrome include subdural hemorrhage, retinal hemorrhage, and brain swelling that is also called as encephalopathy. Causes and risk factor of shaken baby syndrome. Shaken baby syndrome usually results from caregivers shaking the baby out of frustration, commonly because of persistent crying. Lack of parental knowledge about normal infant behavior. And risk factors include young or stressed parents, mental health issues, domestic violence, substance abuse, and poor socioeconomic conditions. Clinical features of shaken baby syndrome. Symptoms can vary depending on the severity of the injury. They may include excessive irritability or drowsiness, seizures, poor feeding or vomiting, difficulty breathing, pale or bluish skin coloration, limp or floppy body, loss of awareness or coma in severe cases, and in mild cases, symptoms may be subtle and mistaken for other illnesses, thus making careful medical evaluation essential. Complications of shaken baby syndrome. Shaken baby syndrome can lead to serious and long term consequences, including permanent brain damage, blindness due to retinal injury, hearing loss, seizure disorders, cerebral palsy, developmental delays, paralysis, and death in severe untreated cases can occur. About 1 out of every 4 babies with shaken baby syndrome does not survive. Diagnosis of shaken baby syndrome. Diagnosis is based on detailed medical history. We can also do physical examination. It involves brain imaging that may include CT scan or MRI and AI examination by ophthalmologists for retinal hemorrhages. Skeletal X-rays are done for bone fracture, especially for the rib fractures, and doctor must rule out other causes of brain bleeding and swelling to confirm abusive trauma. Management of shaken baby syndrome. Shaken baby syndrome is a medical emergency and its management includes stabilizing airway and breathing. That is first step. And second, we reduce brain swelling. Third, we can control seizures and surgery may be needed to remove blood clots or relieve pressure in the skull. Long-term rehabilitation including physiotherapy, occupational therapy and speech therapy is given. Early intervention improves chances of survival and recovery. Prevention of shaken baby syndrome. Preventive strategies are crucial and include educating parents and caregivers about normal infants' crying pattern. It also includes teaching them to take breaks when feeling overwhelmed, never shaking a child under any circumstances, and also teaching of community support programs for stressed families and public awareness campaigns in hospital and child care centers. And simple education can significantly reduce incidence of shaken baby syndrome. Conclusion of this lecture video. Shaken baby syndrome is a preventable yet severe form of child abuse that causes devastating injuries to the developing brain. Since infants are physically vulnerable and depend entirely on caregivers, understanding the dangers of shaking and promoting safe ways to handle crying or frustration are essential. Awareness, education, and early medical care can save lives and prevent lifelong disabilities. And this was all about shaken baby syndrome. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.